Welcome to American Black Journal. I'm Stephen Henderson. The enrollment period has opened for Americans to sign up for health insurance coverage under the Affordable Care Act. It opened just today, November 1st. President Obama signed the act into law in 2010 to make quality health care more affordable and accessible for everybody. In order to be covered for next year, you got to enroll between now and January 31st. You can get more information in the federal health insurance marketplace at www.healthcare.gov. Today, we're going to look at the impact of the Affordable Care Act and give you some vital information about the enrollment process. Joining me are three healthcare experts: Dr. Abdul El-Sayed, who is the head of the health department for the city of Detroit. Bridget Hurd is with Blue Cross Blue Shield of Michigan, and Bryan Peckinpaugh is from the Greater Detroit Area Health Council. Welcome to American Black Journal.
Thanks for having us.
You know, we were talking before the show. I said, I'm not sure most people know that they have to do this. I have not heard anyone talking about it. I don't know anyone who said to me, hey, we've got to re-sign up for health insurance. Getting the word out about this is pretty important.
Absolutely. It's been one of our primary concerns in the health department and really for the mayor as well, to make sure that folks know how it is that they need to sign up, and the fact that they need to sign up every year. It's just like as we move through our lives, we make iterations. We buy new clothes, we might get a new car, etc. It's the same way with health insurance. You have to decide what it is that you want this year. Perhaps your family's grown or changed in some way, and so every year you sign up again and make that iteration.
Yeah, Bridget, what happens if people don't sign up? What happens if they choose not to have the insurance?
Well, with the ACA, the Affordable Care Act, it is a requirement that Americans have health insurance.
You have to do it. Yeah, right.
You have to do it. And so at Blue Cross Blue Shield, we also work to educate people about the importance of signing up, that they need to do it annually. We go out into the community to inform and educate. And the key is, if you don't do it, it's going to be reflected when you go back to do your tax return form. And this year for 2016 is a 2.5% penalty.
Right, there's a penalty that you end up having to pay. And is that equivalent to about what it would cost you in insurance? Or
well,
is
it's up to $695 for this year. It has changed every year since the implementation of the ACA. And so basically it's 2.5% of your annual household income, or $695, which is not the equivalent right now for 2016 of what you would pay for insurance. But as it continues to change and grow every year, it could very well be.
Yeah. Bryan, I would imagine that your agency, you're helping people figure out how they can afford this insurance, number one, but also trying to get them to understand that you have to do it, not just because the law says so, but because it's a good idea to have insurance.
It's really important to have insurance, Stephen, because 80% of the cost of healthcare is from 20% of the people.
Right.
People that use the emergency department as their primary care doctor. That's a high cost of healthcare. Yeah. So we do educate people about how to register, enroll in Healthy Michigan Plan and the healthcare exchange for the federal government, but also how to keep their care.
Yeah.
So how to see the doctor for the first time. Some of these folks haven't seen the doctor at all.
Yeah.
Once they enroll.
We're still dealing with getting caught up on that after the law has taken effect. I mean, there's still people who are going to doctors for the first time as a regular sort of habit.
That's right. We actually produced a video this summer to instruct people, and it's animated, on how to see your doctor for the very first time. What 3 questions to ask. Make sure that you schedule an appointment, because once you schedule, it's easier to reschedule than to try to get a new appointment.
Yeah, yeah. Dr. El-Sayed, you are new here to Detroit, but I just learned before the show that you are a native to this area too, so you're coming home, so welcome home.
I appreciate that.
To the Detroit area. Tell me what you see when you look at Detroit and sort of health overall. This is a really challenged population. It's a really challenged city. Health is one of the ways that I think that plays out more obviously than some other ways. But I'm always curious when people come here sort of new to the area, what do you see about this place that's interesting or different or special?
Well, I have to tell you, I'm incredibly excited to be back. This is a place that's near and dear to my heart. It's a place that I grew up in and I've always loved. And you're right, it does face some challenges. Some of those challenges in particular, we have some of the highest rate of babies dying in their first year of life.
Right. Infant mortality has always been a big deal here.
It's a big deal, and there are a number of countries outside the United States where a baby has a better chance of living to the age of 1 than a baby does in Detroit, and we need to address that. Another issue is
how do we do that?
Yeah. So one of the unique aspects of the city of Detroit, first, is that there are a number of folks here who are doing really, really great work, including GDAC and the health insurers and the health systems. And so they're doing a lot of really good work. Some of what we want to do in the health department is to be able to convene and to make sure that as we convene, we're stronger together, and we can make an argument about investment in the city from actors who are really interested in really helping out. We're all stronger together, and when we can do the heavy lifting one side by side, I think we have a good chance. A lot of what we want to do, Detroit's a really big place. And one of the big challenges about the size of Detroit, right? Detroit in land mass is bigger than Boston, San Francisco, and Manhattan combined, but we have fewer people than almost any of these places. And at the same time, the tragic irony in the Motor City is that a lot of folks don't have access to a car, right? And so what we really want to do is be able to situate health in the neighborhoods, to think about how is it that we place our resources in the areas within which people live, work, and play, and think about the problem comprehensively, right? The best way to make sure that a baby doesn't die is to make sure that people can empower themselves to make sure that a baby that they don't necessarily want at that time in their lives isn't born in the first place. And so it's thinking comprehensively about the problem. What are the kinds of households within which babies are being born into, and how can we make those households a little bit more baby friendly? And so there are a number of things I think we can do, and our hope is that by working together with our partners, we have a good chance at really getting the best ideas to the fore, bringing in resources that haven't necessarily always been here, and being able to tackle the problem in an innovative, thoughtful way.
How much of the infant mortality problem is about prenatal intervention, and how much of it is about what happens after a child is actually born?
You bring up a good point about prenatal. We often think about prenatal being that 9 months before a baby's born. But prenatal is also about the 20 plus years before the young woman gets pregnant. And so it's about making sure that we have a healthy neighborhoods and healthy environment within which people are living, so they can be empowered to make good decisions. Now, to your question specifically, we know that about 2/3 of infant mortality happens within the first 28 days, and often that's attributed to what happened during the pregnancy. We do have a very robust set of prenatal programs. The WIC program in the city of Detroit is one of the best run actually in the country, and it's one of those gemstones we really hold up and say you can do public health really well here. But at the same time, there's a lot more we can do, right? When it's not just about prenatal care, it's also about the kind of food that a mother is eating, the likelihood that she's able to get good regular exercise, the kind of family support that she has in the household. And so it really is thinking comprehensively. How is it that we can address some of the challenges of paternal absenteeism, for example? And that problem reaches far greater than simply WIC clinics where we're telling a woman about how she can be healthier and as a pregnant woman.
Community outreach and sort of building that takes, that's a long-term project and proposition.
Absolutely. Public health has this sometimes has this moniker of being the group that sort of tells you what to do, and we don't really want to do that. What we want to do is be able to weave into the fabric of our daily lives those things that you need to be able to make the best possible decision for your own health. And I think in the city of Detroit, because there are so many partners, people are so focused on the problem. Detroit occupies a preeminent position in the public consciousness of America. People want to invest in that, and I think there's a way forward there.
Bridget, when people are going to the websites and trying to choose plans, I mean, as someone who at least looked at it the first time it was available, and I didn't end up choosing one, but there was a little bit of intimidation, I would say, in terms of just even knowing the difference between the plans, what I'm looking for. You guys do some work trying to help people through that.
Yes, absolutely. I've already mentioned the fact that we go out into the community to help people. We have health plan advisors and community outreach workers who make it a point to meet one-on-one with individuals to sort of help them navigate healthcare insurance. It is complex, it's difficult, it's hard to understand, and we often joke about it. We work in the insurance industry and we don't understand everything. Also at Blue Cross, we have health plan advisors. We have over 600 health plan advisors we've hired over the last last few years just to be available for people to call in and get answers to their questions. It could be the most simple questions.
Yeah.
But the point is being available, having resources, and also throughout the community, there are different nonprofit organizations that are also providing navigators to be available and answer those questions.
Well, and that, Brian, I would imagine that's sort of where your organization steps in,
Yes.
right?
Yeah, we are a small organization, small nonprofit. We're membership based. We only have 8 staff, but what makes us effective is our partners. So we partner with health plans, with Blue Cross and with the city of Detroit to carry out our mission.
Right.
So we're able to educate people about the clinics too. You can also have a health clinic as a primary care provider, not just a doctor at a regular medical center.
Sure, sure.
Clinics like Cabrini in Corktown.
Yeah.
So there's some options for people.
What have we seen in terms of the effect of the Affordable Care Act on Detroit since it's been implemented? I mean, I know that there are more people who are insured, but of course, the long-term goal is to change health and health habits. Are we starting to see that take hold?
Brian made a fantastic point earlier. Healthcare coverage is not just for people who are ill. It's for people who want to stay healthy.
Supposed to stay healthy. Right?
And what we're seeing is because of some of the funding for preventive services, things that weren't always guaranteed in other health plans or that people didn't have access to because they didn't have insurance, we know that Detroiters are taking advantage of those things, and that's having a knock-on effect on their health. Unfortunately, it takes a long time to measure, and we're just early on. But it's pretty clear that as we look on the horizon, it's getting better. We also know, just in terms of the solid numbers, there's been a 25% reduction in the number of uninsured in the city of Detroit.
In the city, okay.
In the city of Detroit specifically. And we also know that while there's still more to go, that's happened through 2 different systems. It's people signing up for health insurance, and at the same time, it's the state doing the work of taking on the Medicaid expansion and making sure that those in the city who might not be able to afford health insurance have access to care when they need it through that program.
Yeah, I was going to say, that's a big part of Blue Cross as well. People who can't necessarily afford the plans, you're working with them as well.
We're working with them and connecting them to the right plans that's available. So you have regular insurance products that are available on the marketplace, but then also there's been the expansion of Medicaid.
That Medicaid
And so you have your traditional Medicaid, but there's also Healthy Michigan, which is the vehicle for those people who might be in the gap, but that gap is filled because of that product.
Yeah.
So we have to direct people to the right resources. I do want to add that the focus on prevention is so essential with the implementation of the Affordable Care Act. So what we're seeing and what we always promote is just getting people to focus on increasing their physical activity, making good nutrition choices, and going to see their doctor. Simple messages, but messages that are beginning to hit home as more people have access.
Yeah, okay. Open enrollment period is November 30 through January 31st. They can go to healthcare.gov, but is there a city website as well that helps people navigate?
We're working with a number of partners, and we recommend that we want to have one place where everybody can go. So healthcare.gov is really the place to go. There are a number of institutions, whether it be the health insurers or groups like Enroll America, that really are offering support. So if there are ever any questions, though, if folks would like to call the health department, we can definitely point them in the right direction.
Yeah.
And so
I got to correct myself. I said November 30th through January 31st. It's November 1st through January 31st. So today is the beginning. Yeah, go ahead.
For your coverage to be effective January 1, you need to sign up by December 15th.
Okay,
so
that's an important. Okay, so get that done by December 15th.
Yes.
Okay, thank you guys very much for being here.
Great.
Thank you
you
for
having us.
Thank you.